It's another day with the physicians where your health is our business.
The growth spot will end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the joining us on your regular program. While most of us panic when we feel a lump or bump in our bodies, it is often not a case of concern. After all, the lump can, in likely cases, mean cancer. But not every lump or bump should cause concern or worry. A number of skin or medical conditions can cause lumps and bumps to appear on the surface or just below the skin. While lumps on or under the skin may result from conditions that give rise to certain skin rash, many other conditions can result in solitary raised lumps on the skin. Our experts will intimate us more on lumps and bumps and when you should worry. Hello, there is another beautiful day with the physicians where your health is our business. My name is Dr. Martina Agberi. I'm going to be your anchor for today's program. My co-host, Dr. Mimuna Yusuf Kadiri, is unavoidably absent. Well, we'll roll with it. We'll be talking about bumps and lumps. How often have you set yourself? For the women, have you been able to isolate one lump or lumps? Do you worry about them? How about the ones on your face? Do you call them the pimples? Do you also call them lumps or bumps? Do you think it's a medical challenge? Do you think you need help? Again, for the females, I ask, when you touch your breasts, do you feel any lump? How big is it? How small? What is the size? When you feel it, how does it feel? Is it rubbery? Is it solid? Is it hard? Is it firm or it is soft? Does it run in the family? A lot of questions begging for answers. Well, I'm not going to be alone to answer these ones because I have with me, coming on board, a consultant. I don't want to call his name yet. He's a regular face on our program. That is his field. That is his expert. He has a passion for it, to talk about the lumps and the bumps. Again, for children, do they feel lumps also? Do they need to worry? How about for the men? You're looking at me? Yes. Have you been able to check your breast if you also have a lump? It is not only the females that can have lump in the breast. Men also do have lumps on the breast. I'll be back after this time out. Just stay tuned. Welcome back. If you are just joining us here onto your regular program, The Physicians, where your health is our business. Today we're talking about lumps and bumps in or on your body. And with me in the studio is a consultant, orthopedic surgeon with special interest in orthopedic oncology. He is no other one than our very renowned Dr. Sheyi Udo. He is with the Orthopedic Hospital, Igbobi. Doctor, you are welcome to the program.
Yep. Thanks for having me.
Nice having you again. I really appreciate it.
Thank you. Thank you.
Okay, we'll be talking about lumps and bumps in or on your body. Okay, so let's say lumps and bumps. When should one worry?
Okay, so I'll start with what lumps are. As you know, they're swellings or raised or elevations on your skin or any part of your body that you can feel. You may be able to feel that with your hand and define that this is abnormal and is raised. And you should worry about every lump, but you should be more worried about the ones that are larger. The ones that usually people say in most parts of the body, say on your extremities, anyone that is larger than the size of a golf ball or tennis ball, a table tennis ball is about the same size, 4 centimeters, should actually be properly evaluated and examined by somebody qualified. In some other parts of the body, like the breast and your testes, any lump is bad. So even if it's less than that, but it's located in those salient, those particular areas, you need to be more worried.
When you say extremities, remember?
So your extremities, we're talking about your hands, your upper limb or your lower limb.
Okay.
So legs, thigh, arm, forearms. That guideline was developed for that because of the malignant, a particular malignant condition called sarcomas, which are just cancers of the connective tissues of the body.
Okay.
But that also applies to trunk, because some of those cancers can occur on the trunk, which is your back or the front of your abdomen or your chest as it is.
Okay. So before we go to the medical conditions, what are the most common causes of lumps and bumps?
So, as you know, my background is musculoskeletal tumor. So for us in orthopedics, the most common cause of lumps and bumps are the sarcoma, the soft tissue tumors.
Okay.
So soft tissue tumors can be benign, which are the ones that don't spread. They usually just cause trouble locally, or they may not cause any trouble at all. And the malignant ones are the cancers.
Okay, so when you say soft tissue,
yes.
so that they understand,
So
what are the ones, when you refer to soft tissue?
okay, so soft tissue, by the way of soft tissue, we're talking about our skin,
Okay,
the ligaments,
okay,
the tendons,
okay.
the
The muscles?
Okay. And of course, things are underneath the muscles, like you said, and of course, fat. There's a lot of fat underneath the skin.
So fine, you talk about the benign and the malignant ones just now. Under normal circumstances, everything is fine. Suddenly you begin to find that you have a lump or a bump somewhere. What may be responsible? What can just give rise to that when it's not trauma?
Okay, so the actual cause of it, nobody knows, but there are associated conditions that science has identified. If you've had a lump, for instance, there's some lump that have been there for years that can transform and develop into malignancy. Why they do is still not clear. They are subjects of research. If you've had previous irradiation, so people who have had treatment with radiotherapy have a tendency or have a risk of developing cancer of the soft tissue or bone, as it were, years after that. Some hereditary conditions, there are some common conditions that run in the family. So these familiar conditions predispose individuals to developing those cancers around the soft tissues, like we've said. Also, chemicals. In fact, studies even locally around the Niger Delta region has identified increased rate of cancers of these soft tissues that we say in people who live around where there's pollution because of the oil mining activities and so on. So these are just in brief. And of course, viruses. So a number of viruses have been associated with development of soft tissue cancers. But I think it's more important to understand the associated factors so that we can deal with the ones that we can avoid as it is.
So when should an individual worry?
If it's, like I've said earlier, if it's growing bigger, you notice the swelling and it's going, rapid in size, growing bigger. Or is at the time you saw it is more than 4 cm, like the golf ball or the tennis ball that I've said. We're talking about the table tennis ball. Or, you notice that it's deep. So another guideline especially for people who can observe very well, or physicians, is anyone that is deep to the deep fascia. So a lot of us will know what the deep fascia is. But if you speak to your doctor, Your doctor can pick whether this is actually on the surface or is deeper to the deep fascia. Maybe that's coming from the muscle. Those ones you tend to worry about. And the reason we say worry about it is the earlier that is diagnosed, what that entails is they will do special scans, send you for what is called biopsy, which is taking a little bit of tissue, sending to the laboratory, looking at it to confirm what the nature of the swelling itself. The earlier you do that and you start treatment, the better the outcome.
Okay.
But a lot of them can be cured that way. A lot of people are still surprised that cancers can be cured, but if you pick them at that very early stage, you can actually get a cure out of it.
For it. So is there any particular age group, or anyone can actually have it? Like the adults, children can also have it?
So particular soft tissue cancers occur in particular age group. The children who are less than say 18, they tend to have a predisposition to develop what is called rhabdomyosarcoma. Okay, and of course the treatment has been very good if you pick them early these days. Treatment is chemo drugs, which is special drugs to kill the cancer cells, and children tend to do well.
Okay.
But generally, soft tissue cancers tend to occur more in the older population.
Okay.
So you're talking about when people are getting to their 50s, 60s. That's when you tend to get many of the other soft tissue cancers.
Okay. So at least for children,
There's a specific
there's a specific time. Then it's getting very interesting. I still have a lot of questions I will ask you. Just hold on. After this break, I'll come back to you. My dear viewers out there, just hold on. We'll be back after this short break. Don't go away.
Yes, I do. As I said, I have one of my cousins who has it.
Yes, I've heard about it.
Yes, I've had lumps and bumps before on my forehead.
So I believe it's a natural disease.
That is a kind of a skin disease.
I cannot say precisely what causes it then. I just found out I had this big thing swelling in front of my head.
For me, it will be a concern because, every human being has this thing. You understand me? When something happens to you, your own is to prevent that thing not to happen, or to give that thing a cure.
I think it's not proper to have it on the body.
Yes, I was worried when I saw the lumps on the lump on my head.
No need to panic. If it happens to be with you, you have to feel okay and try to find a solution for it.
No, why will you panic? Because it's just a trial. You can go to the medical center and apply some herbs, and then I believe with that everything will be okay. So you shouldn't panic.
Well, there's no cause for panic.
Traditional may also be okay, but depends on which herb I prescribed for you.
Just make sure you do some medical appliance on it, either medically or traditionally. Then definitely it will go.
Anyone, it depends.
Welcome back. If you are just joining us, you're on to your regular program, The Physicians, where your health is our business. We've been talking about lumps and bumps on your body, in and on your body, when you should worry. And Dr. Ideu, a consultant orthopedic surgeon with special interest in orthopedic oncology, has been doing justice to that topic. And really, he's just told us that even children can have it too, can have lumps and bumps, which cause for worry and concern. So parents need to actually take more care. But the interesting thing is that with children, it's much easier to deal with when picked up much earlier. But for adults, those the elderly, when they have lumps and bumps, it actually causes for concern too. So, but early detection is key. So Dr. Ideu, we're talking about lumps and bumps, and you've told us about the children and elderly. So now let's talk about management. How do you manage them?
So you've spoken. The management is you've emphasized in your talk just now. Early detection. Okay. So if you pick it early, the management is better and easier. And by way of management, we're talking about number one, if you speak to your doctor, if he's not an expert on management of lump bumps, he will probably refer you to a specialist. Okay, so after that good history, we want to examine you, check out where the location is. I mentioned there's some critical area like the breast and the testes, that any lump is actually bad.
For the men, the testes?
For the men, the testes.
Then for the females?
For both sexes.
Okay.
The breasts.
Okay.
So breast lumps can still occur in men, and it's still not good. Men still need to check that.
Is it really common for men?
Not that common for men.
But it's
it
important
does
to know.
happen, and there are some conditions that predispose you to developing breast lump as a man.
So you're right, the men to also check their breast.
Exactly. So it's advisable for everyone to check as well. So I haven't picked the lump. Of course, the physician will want to check all this, check the size, measure, and then do special imaging.
Okay.
Like sometimes it may be ultrasound scan, or it can be what we call the magnetic resonance imaging, which are special scans. You go into a big tunnel, and it just gives you a good picture of what is going on in those soft tissues that are described. That's whether it's underneath the skin, whether it's in the muscle, ligament, or in the fat cells. So you're able to see the nature of the tumor as it is. After this, they will probably want to do what is called a biopsy. A biopsy is just a procedure usually done. It can be in the office, that's in a clinic, or sometimes you may need to go to theater for that. Is to take a piece of that tissue, put it on a slide, and then send it to clever doctors that we call pathologists.
Okay.
They look at it. They are like judges in
the
courts, and they tell you, oh, finally, this is likely to be, or this is benign, or this is malignant.
So biopsy is the main thing?
That's the final score in terms of making the diagnosis. Of course, there are processes to that. That's what I've described, from the imaging to the biopsy. So I haven't gotten a diagnosis. If it's the simple ones like the benign ones, you can usually just, if they are bothering for cosmetic reasons or they are impinging on soft tissues and causing trouble around the joint, you may just want to remove them, which we call an excision. Just remove that, and usually that should be okay in most cases. The ones that we should worry about that I've been emphasizing are the ones that are cancerous, because that you then need to plan with somebody who has a lot of experience to remove it widely, what doctors will call wide local resection.
Okay.
What that means is that you're not only removing the
lump
itself, you're also removing a bit of the normal tissue, so that you're giving it a good margin, and then you have a less or a reduced chance of that coming back. For some tumors, that may not be enough. Some will still require, when the wound has healed, you need to subject them to radiotherapy, which is now available in most teaching hospitals now, and of course chemotherapy, which are also, that involves special doctors who give special drugs, which are cytotoxic drugs that kill the cancer cells. And of course, these require monitoring over time. So such patients are patients that you want to monitor over a long period, regular clinic appointment, check out to make sure that it does not reoccur or come back as it is.
Okay. So when you have patients that have these lumps and bumps, and then you think that it's probably malignant, are all doctors supposed to handle them, or they usually should be taken care of by some other people?
So no is the answer. The care of such conditions are specialized now, and it's not even a one doctor affair. What is recommended in worldwide and in most countries is to work as a team. So you have what is called a multidisciplinary team, which may consist of a surgeon whose bit is clever at removing the mass, the pathologist that I mentioned earlier, they're the ones who look at it under the microscope, they look at it and give you a diagnosis. The radio-oncologists, who are specialists in applying radiotherapy, which is like special rays to kill cancer cells. The medical oncologists, who are able to design medicine, cytotoxic drug that can kill the cancer cell. Of course, you have other, specialists like radiologists. Ab initio, they are the ones that's at the beginning, they look at the scans for you, interpret it properly, and give you the right advice that this is the one you should be worried about, or this is the one you shouldn't be worried about. And they can also, sometimes they double as, they take the biopsy, they're able to guide the biopsy in their x-ray room using special scans to be able to pinpoint where lumps are, especially for lumps that are in a hidden part of the body. Okay,
now you talked about the hidden part of the body. Let's zero down to the main.
Yeah.
For the testes, okay? Yeah. The lumps that they usually have, could it be just benign, or it can become malignant?
So, similarly to what I've explained about, the extremities, the limbs. Lumps in places like Texas can be benign or malignant.
Okay.
What is important is that any lump around there should be properly examined. So size doesn't really matter too much around the testes. What you should do, number one, is what I've described earlier, clinical examination by somebody qualified. Usually a urologist. That's what the specialists who look after that area are the urologist. And if you find someone who's got experience, who want to examine you well, subject the testes to appropriate scan, whether it's an ultrasound scan or other complex scans like prescribed MRI scan, and then tell you whether this requires a biopsy or not to make that diagnosis. Okay. And of course, the smaller the size of the lump around those areas too, the better the chances of eradicating the disease, getting a cure, and prolonging the patient's life.
Wow. So for men also, talking about these testes, if it's not properly handled, it can be a cause of infertility for them too?
Yeah, I'm sure it can, because that's even the least of your worry. That's if it doesn't spread to other parts of the body and kill the individual. So of course, it can be a cause of infertility, but I think that's a lesser worry than life-threatening conditions, especially when it spreads to the lymph nodes or spreads into the lungs, and then can impair survival. Okay.
So if you pick a lung from somebody, from an individual, is it possible to run in a family? Is there a family history?
So
can you link it?
Yes, there are some lumps that are associated with familial. There's a family history that predisposes some people to developing lumps. What I think individuals should be aware of now is if you have a family history of either cancer or somebody that developed some lumps in your family that grew bigger and then led to more serious disease, you should be worried if you see anything suspicious.
Okay.
For some people, especially people who have particular genes on their body, are advised to cut off or remove their breast. It depends on where specialized gene studies can be done, and you pick that you have a very high chance of developing cancers. People tend to do what is called prophylactic surgery to just remove that part so that they reduce their chance of developing the cancer.
Wow. Thank you very much, Dr. Ido. It's actually a pleasure. And you've actually done justice to this topic, bumps and lumps on your body, in and on your body. I'm glad you made it for the program, and I'm sure we'll call on you again to come and enlighten us more. And for our viewers out there, I'm sure you have heard all that the expert has told us. It actually calls for concern and worry when you have lump. Don't take it for granted. You never can say what it represents, whether it is soft, it is firm, or it is hard. And also he told us that it's more on the extremities. Extremities, it can either be on the forearm or the lower limbs. Then for women, try as much as possible to examine your breast. And not only the women, he also talked about the men. It's also possible for men to have lumps on the breast. And so you need to also examine that. If you find anyone, go to the hospital. Then he mentioned something like the size. The size actually matters. If it's more than 4 centimeters, do not hesitate to see your doctor. Go to the nearest hospital, see your doctor, and you'll be referred appropriately. Then finally, he also talked about the children having it. Children can also have lumps and bumps too. But the good thing is that it is much easier to deal with the children who have it, and the care is given to them than when it becomes the adults then. So with this, we want to call it a day. Same time next week. Ensure you keep a date with the physicians, where your health is our business. Remember to follow us on our social media handle, Facebook, Twitter, Instagram, and of course YouTube. If you have been missing on past episodes, never mind. You can always keep a date with us on the social media, on our YouTube. We have all the past episodes uploaded there. Take care and God bless you.
I'm Dr. Bolariwa Akinola, consultant orthopedic surgeon at Cedar Crest Hospitals, and I'm here on the physicians presenting on low back pain. Your back is very important to the way you move, to the way you walk, and you should look after it. On this program, I give you tips and I give you ideas on how you can do this, and as well as things to look out for to visit your doctor when the pain is getting too bad. Keep watching the physicians. It's an important program. You shouldn't miss it.